Hi everybody, Med Made Easy here. Today I have a video about compression fractures. Now if you are a nurse, a nursing student, you've likely seen this diagnosis before and you've likely even taken care of a patient with this diagnosis. So I wanted to go into a little video to discuss a little bit more about compression fractures because a lot of patients will ask you, what is a compression fracture? And there's just some key things to know about it. So let's get into the key informational tips that you need to know. So let's get started. To better understand what a compression fracture is, we must first understand the anatomy of the spine. The spinal cord is protected by a spinal column. The spinal cord is basically what controls your movements, your muscles, everything. It's very important. It's basically how the brain connects the messages, the input, the output to the rest of the body. The spinal cord contains lots of nerves that transmit incoming and outgoing messages between the brain and the body. Now, the spinal column, it's kind of the basically the protector, as we said. It's made up of 33 total bones, and bones are called vertebrae. The spinal column basically protects the spinal cord. It gives the body the ability to twist and turn and do all the things that you do every day without even thinking. Each one of the vertebrae are stacked upon each other. There's 4 different regions of the spinal column: the cervical, which is the neck area, the thoracic, which is basically your trunk, and the lumbar, which is the lower back area, and then of course the sacral, which is basically around the pelvic area and your tailbone. Now that we have a better understanding of the anatomy of the spine, let's talk more about what a compression fracture actually is. Sometimes for various reasons the bones in the spine can become brittle and weak and they get softened. There's lots of different reasons, but one of the most common one is osteoporosis. And this is women, we often see this with women, particularly because the lack of estrogen after menopause. Estrogen helps with bone protection and all of that. This is why we say it's so important for women to take vitamin D and calcium. There are other things that can cause compression fractures like trauma and even cancer. So we obviously want to make sure we're evaluating these different things for these different things. If we have a suspicion if someone's having recurrent, be an underlying cause, and most likely there is. Some people have compression fractures and they don't even realize it. But what can happen over time is the shape of the spine can actually begin to curve and change. And you've probably seen this in some elderly women specifically, and sometimes men as well, as they get shorter and shorter over time and they have that hunchbacked appearance. One of the most common symptoms of a compression fracture is back pain. So here is a list of some other signs and symptoms. Slowly worsening of back pain, a decrease in your height, limited movement in your spine, especially if you can't bend or twist, a stooped over posture, often called kyphosis, and numbness or tingling, weak muscles, gait disturbances, troubles with your bowel or bladder. Compression fractures, actually, people will have them and they don't even realize they have them. They just think it's a part of aging, a process of aging, and they just go about their way and they deal with it. There's different kinds of treatment for a compression fracture. One of the most important things that you can do first off is slow the process of osteopenia, osteoporosis, if that's the case. Sometimes physical therapy is also recommended as well. There's also special braces that can support the back to kind of take the pressure off of that area. And of course, there's the surgery for compression fractures, but of course the patient would need to meet the criteria and theirs to benefit would definitely need to be measured. So now that we have a little bit of understanding about a compression fracture, what I would say as far as nursing care, let's talk about that because I think this is an important, essential part of knowing about compression fractures. Now, I want to go over some different things that are important in nursing care, and I'm just going to kind of list them as we go along. Number 1, pain control. Obviously, that is something that is going to be super important. Now, generally, because most of the patients that you're probably going to see who are diagnosed with a compression fracture, they're going to typically be an elderly individual. Now, the thing with that you have to also take into consideration is elderly individuals a lot of times are going to be more sensitive to narcotics, pain medications, that type of thing, and so you have to worry about the side effects: respiratory depression, also things like constipation, itching, confusion, and just hallucinations, things like that. So it's very important to consider what kind of pain medication that these individuals are going to be able to tolerate. We obviously also want to consider the fact that they may be a fall risk, and so when we're giving them sedating medications, this just increases the risk to have a fall. Sometimes in the elderly, we'll use things as simple as Tylenol for the pain. I've seen medications like tramadol, which is still controlled, but I've seen tramadol also given. Number 2 thing to consider when taking care of a patient with a compression fracture is their increased risk to fall. Now, obviously, the vertebra, they protect the spinal cord. That's a part of what it does. And so when you get a compression fracture, that stability of the spine, it's just not there as much, and so thus they're more likely to fall. And so doing things like having the bed alarm on, or having the non-skid socks, or having a walker nearby, or educating the patient on that they need to call when they try to get up, or having a urinal by the bedside, those are important things to help prevent falls. And then also doing things like physical therapy, making sure that that is ordered on the chart. If you don't see it, call the on-call doctor, or if you are the on-call doctor, making sure that that gets ordered, physical therapy and occupational therapy. Number 3, moving on. Now, a lot of times when someone has compression fractures, they do have decreased mobility. And so one of the things that we do have to consider as a potential complication from that decreased mobility is blood clots, or I should say having a DVT, or even a PE, DVT that goes into a PE. So with that, this is super important to recognize right away promptly that number 1, you have some kind of preventative measure on there, whether or not it's something like Lovenox or heparin shots, or if it's the sequential compression devices, the SCDs that you hear sometimes, making sure that those type of things are on the chart as an order. So number 4 thing that is important to the care of a patient with a compression fracture is having an idea of what the treatment plans might be, specifically if the patient is going to have a surgery. Now, although the surgeon should be the one that is answering the questions about the surgery specifically, it's a good idea that you kind of have an idea of some of the different kinds of surgeries that are performed for compression fractures, and also what kind of candidate may be more likely to have one of these surgeries. So you can see here there's the vertebroplasty, which is a procedure that's used to place bone cement into the fractured vertebra. And then there's the kyphoplasty, which is a procedure that uses a balloon to make a space in the fractured vertebra. Bone cement is then put inside the space made by the balloon. So it's important to have an idea of what these are. So this is more about you really just having the knowledge. So if the patient just does say, hey, what is this surgery? What am I going to have done? It's still, like I said, the surgeon should be the one answering the questions, but you should have an idea of what kind of surgery was done and what they actually do in the surgery. Moving on to the final thing, which is mobility. And of course, there's other things to take care of patients with compression fracture, but these I found were the most important things. The final thing, mobility, is that this is super important because we obviously don't want this to happen again. We want to help strengthen the patient so then they can be able to move and enjoy their life and with the least amount of pain. Now, physical therapy is a big part of this to help strengthen areas in their bodies, specifically their muscles. And then, of course, the prevention that you want to do with preventing, whether it's medications at their primary care, that will all be something that might be considered. But mobility is a huge one because this patient is going to probably see the physical therapist and they're going to teach them how to improve their movement and strengthen certain areas so then they don't have as much pain. Because pain is a big issue. And then, of course, an occupational therapist is another individual who comes along and they help them with their daily activities like dressing and just doing the everyday things that you normally do. Well, that's it for this video, guys. I hope you enjoyed this. I hope this was helpful on explaining a little bit about compression fractures. Also, check the description box for products that I recommend. They are affiliate links through Amazon, but what I've done is I've gone through Amazon and I tried to pick products that I feel like are related to this video. It is a small percentage of, if you do purchase something, then it does go to help our channel, but it is stuff, like I said, that I choose, that I decide that I think is appropriate and would be helpful or useful for you in relation to your nursing journey, or if you're someone that's learning about compression fractures or different things like that. Anyways, alright guys, well thank you very much for watching this video. Also, feel free to share your tips below on things that you have learned over the years or in nursing school or whatnot from different ways to take care of patients with compression fractures. We'd like to hear that, and make sure to hit the subscribe button, the thumbs up to let us know you like these kind of videos, and also the notification bell so you can get the latest videos. Alright guys, until next time.